Magandang hapon po sa inyong lahat, sa mga nakikinig sa FB at sa mga kasama ko sa Zoom ngayon. Good afternoon din sa mga sisters ko sa breast cancer community. Gusto ko rin batiin po ang mga breast cancer patient groups na kasama natin galing sa kung saan-saan, no? Gaya ng Taguig, Muntinlupa, PGH, Parañaque, Jose Reyes, Malabon, Isabela, Bacolod, Leyte, Cagayan de Oro, Tagum, Davao, Cebu, Zamboanga at marami pa pong iba. Welcome to another webinar brought to you by the I Can Serve Foundation and I Can Serve Cebu. Alam ko na marami pa kayong pangamba tungkol sa vaccine. At doon sa mga nagpabakuna na ay marami pa rin katanungan. So feel free to post your questions and comments on the Zoom thread or sa FB comment section. Maaari din yung balikan ang recording na ito dahil iiwan lang po namin ito sa aming FB page. With us today to host this conversation on bakuna at breast cancer is Daphne Osenia Paez, a UNICEF National Goodwill Ambassador. She champions child rights and vaccinations. She's also a TV host at isang suking volunteer ng I Can Serve. Siguro pag wala ng pandemya, or at least nakadalawang bakuna na ako, she'll be one of the first persons I'd like to visit. I really miss this friend of mine. Thank you for doing this, Daphne. So friends, please welcome Daphne Osenia Paez. Over to you, Daphne.
Thank you so much, Cara. I miss you. Thank you for inviting me today. And thank you to I Can Serve. As Cara mentioned, I'm a big champion of vaccination. Right now, it may not be perfect, but it's our best chance to put an end to COVID. The pandemic has disrupted and destroyed many hopes and lives. Maraming haka-haka, maraming maling akala. Andito tayo ngayon para ituwid ang mga ito. Mapalad tayo, may eksperto tayong magpapaliwanag sa atin kung ano ang vaccine kontra COVID. Safe ba ito sa mga breast cancer patients and survivors? Ang guest natin ay si Dr. Ana Lisa Ong Lim. Siya ay isang professor at Division Chief ng Infectious and Tropical Disease Department of Pediatrics at the College of Medicine sa UP-PGH. Siya rin ay miyembro ng Department of Health Technical Advisory Group at ng IATF o yung Interagency Task Force on Emerging Infectious Diseases. Miyembro din siya ng Interim National Immunization Technical Advisory Group para sa COVID-19 vaccines. Isa siyang fellow ng Philippine Pediatric Society kung saan siya ay miyembro ng Board of Trustees. She has published studies and research extensively on pediatric health, infectious diseases, and is heavily involved in clinical trials of pediatric vaccines. Isa din po siyang proud breast cancer survivor at miyembro ng I Can Serve Sisterhood. Please welcome Dr. Ana Lisa Ong Lim.
Hi, Daphne. Good afternoon. It's such a pleasure to be with you and with this community.
Yeah, it's I know it's a busy afternoon for you, so thank you for being here and making time for us.
Of course.
Having questions, so we'll get straight to the point. But first of all, let me ask you, how has your experience been with the vaccine?
Oh, so because I'm part of the PGH community, we were actually given the chance to be vaccinated at the instant that the vaccine arrived, no? So I have to say, nung napalita, we actually had registration, I think mga February ito eh. So nung dumating na nga, nung sinasabi sa amin na, oh, it's time to register, medyo OA, pero na-teary-eyes ako. Kasi, you know, we see this thing day in and day out. We have colleagues who have passed away because of COVID. So you can't help but think about them. Yung parang kung inabot siguro nila to, baka nandito pa sila ngayon. So that was very emotional for a lot of us in the PGH community, I have to say. So when I was vaccinated March 2, and when that rolled around, I was pretty excited to get the vaccine. I really felt a huge sense of relief, no? Parang kahit na hindi mo siya iniisip sa araw-araw, nung nandun na, iisipin mo parang, nasa isip ko pala siya kasi parang gumaan yung pakiramdam mo na you don't have to worry about this issue anymore because you're vaccinated. And after that, I tolerate vaccines pretty well eh. So I didn't feel anything at all. Panay nga akong ganon. wala akong nararamdaman. Ayoko maniwala na nagpabakuna na ako. And that was also the same experience with the second dose.
That's wonderful. Since you shared that, I'm going to also share that I have been fully vaccinated, also under A3. Ang story ko naman, I'm a big nerd talaga. I have been reading so much, although I'm not a doctor, but as a UNICEF ambassador, I used my time to know everything from the WHO, and we are partners with the DOH as well. So I've been reading, trying to understand all of this, and I thought that when the vaccines would finally come here, matagal pa ako. I thought next year pa ako. But as a really nerdy citizen of Parañaque, I was reading all the updates of my LGU, and they had the registration in January pa. So actually nag-register ako January pa.
Wow. Nauna ka pa sa amin.
It's actually pilot ang Parañaque yata, pilot city. So I registered not expecting anything. And then nung March kayo, mga healthcare workers, and then by April, nag-announce sila na mag-A3 kasi yung Sinovac hindi pa available for the elderly at the time.
Yes, that's right.
Remember? And we only had the Astra. And ang dami ng Sinovac na dumating. Binigay agad sa A3. So ako yung one of the first days of A3 na una ako. So same as you, naiyak din ako dahil this was in April. And as you know, nung March, ang dami ring dito sa NCR, ang dami ring nag-sakit, and it was a crisis also again in the hospitals. So I felt a little guilty for being there, and then for like, is it really my turn or did I take somebody's slot? But I was so emotional. Iyak na naman ako. Pero as everybody that I consulted said, you are doing your part. Yeah. Because when you get vaccinated, you're not only protecting yourselves, you're also protecting others. And
that's right.
So I just used my voice to advocate that, it was safe and I'm fine, and I had my second dose, and so now we're here. We're going to talk about this and its relevance to the breast cancer community. So Doc, if you could just walk us through in layman's terms, I know that you're quite the expert on this, but what is the COVID vaccine and how does it work and why is it important?
So COVID vaccines are going to be a really big player in how we control this pandemic, in the same way that vaccines are able to make a difference in terms of other infectious diseases. So I think the most familiar outbreak that people might be able to keep in mind is the one that we had right before the pandemic started in 2019. Di ba nagka-Measles Outbreak tayo, if you recall, no? So in February, we got on the global spotlight because the Philippines was declared as having a measles outbreak. And in fact, nakakahiya man aminin, tayo nag-export sa Disneyland, saka tayo rin yung nag-export sa Australia. So galing yan dito sa Pilipinas. And I think in the space of about 4 months, we were able to control that outbreak because of a supplementary immunization activity for measles for target children 5 years and below. So that story has played out always, very frequently whenever there are infectious disease outbreaks. And obviously, ang COVID is an infectious disease. And ang pag-asa talaga natin is once there's an effective vaccine, we will be able to make a really huge difference in terms of controlling its spread. Kasi lahat naman tayo throughout the world, what have we've been doing? PPEs, distancing, circulation, pero it hasn't really made such an impact. But once these vaccines came in, and in countries where they've been rolled out, we see the numbers and they're really tumbling down. So we hope that this will also be the same case here for us in the Philippines.
Okay. Now that you mentioned the measles, one of the public service announcements I did for UNICEF and the DOH was also polio. We also have
polio,
and kids under 5. So I think the Philippines is not new to mass vaccination via the government. I've seen it from Luzon, Visayas, and Mindanao in some of my field visits. But ano ang difference itong COVID vaccine? Because it's global and it's new. I mean, vaccines are not new. We know vaccines work, but the COVID vaccine is so new. How much do we know about it?
Okay. So you hit the nail right on the head, no, Daphne. Talaga kasi ang problema, the program, people think about vaccines as something that kids get. And this time, it's not kids. We're targeting adults. We're targeting particularly the elderly. no? And the other thing is this vaccine is quite new, no? We have to admit, COVID was an unknown until December of 2019. Who knew there was such a thing? So the vaccine is also very new, and I guess that gives people a little bit of a hesitation, no? Parang wala kasing record of safety and efficacy, and yet because we need to balance waiting forever for all of this data to come in versus using what we have right now, which is very acceptable to be able to address the pandemic, and risk-benefit assessment-wise, it really emphasizes that we can benefit from this vaccine now, even as we continue to monitor, you know, the outcomes of the trials.
Okay. Because maybe let's talk about are all the vaccines, there are many brands, are all the vaccines created equally? What are its effects and how do they work? Are they all, there are differences between them?
Right. So maybe I'll take this chance to talk a little bit about the technologies behind it, just so people understand it better. So, we've heard about different brands, no? Parang ngayon, ilan na ba yung ginagamit natin sa Pilipinas? Maybe I should just mention the brands because people are familiar with it, no? So we have the Sinovac, we have AstraZeneca, we have Pfizer that just came in very recently. We also have Sinopharm that's also already has an EUA. So there are 4 brands. There's also Sputnik, that's right. So we have 5 brands now. And those are brands, but they utilize different technologies. And overall, there are 4 major groups of vaccines. The first one is our whole virus platform, which is the classic technology. It's the same one that we use for measles, for a lot of the flu vaccines, the hepatitis vaccines. Basically, you just get the whole virus, you kill it, you put it in a vaccine, you inject it, and the body reacts to it and produces the soldiers. So in this category, you have your Sinovac and Sinopharm vaccines. Whole virus, old technology, very classic platform. Then there's the protein subunit, which we don't have yet, so I probably won't talk about that muna. Then we have the 2 others, which is the mRNA and the viral vector. So what these 2 have in common is that instead of using the virus itself or bits of the virus, it's using the genetic material of the virus, the instruction manual, so to speak. And that finds its way into the vaccine. It's injected into the body. The body's machinery produces the part of the virus that's the target as well as the antibody. So for the viral vector, that's the technology being used by Astra, by Johnson & Johnson, by Sputnik. And then for the mRNA, that's Pfizer and Moderna. So basically trying to get the body to produce soldiers to fight against the virus, either using the whole virus, bits of the virus, or genetic material of the virus.
Is one technology better than the other?
Well, I think in terms of the bottom line, which is how effective is it in preventing disease, their numbers are actually quite comparable. And particularly with respect to being efficacious versus severe disease and death, the numbers are pretty much similar across the different platforms.
Okay. Are there any vaccines, particular vaccines best suited for breast cancer patients?
Okay. So right now kasi, we have to admit that the experience for these vaccines is pretty limited, no? Kasi most of the advanced trials happened starting July of 2020. So we're just hitting the first year of observations. But of course, before we got to that point, there were earlier stages where they already demonstrated safety and efficacy. Now, unfortunately, because most of these clinical trials will include people who are healthy, no other illnesses, then breast cancer or cancer patients in general were not really included in the patient mix But based on our understanding of the platforms, there shouldn't be an issue with any of the platforms being used if a breast cancer survivor were to use it or were to be injected with those vaccines.
Okay. All right. I get that. Doc, are you still there?
Yep.
Oh, okay. Also, I think your mic is touching your t-shirt and making a buzzing sound.
Let me get rid of that first. Sorry.
Oh, but
I'm so
fine.
sorry.
I can
Is
hear
that
you.
better?
Like I just saw the comments. Yeah, okay, we're addressing that. All right, so let's keep talking about its relevance in the cancer community. Uh, for breast cancer patients currently on treatment, do they qualify?
Oh yeah, definitely. No. So
Actively undergoing chemo or radiation right now.
right. They do. I think one thing people need to understand is that we want to target people who are at highest risk of getting severe COVID or dying from COVID. So maybe it will be good to talk about sino-sino ba yung mga yan, di ba? So these are people with chronic heart disease, chronic lung disease, kidney disease, diabetics, people with hypertension, people who are obese. What else did I miss? And then, of course, the special population. Asthmatics because they are under chronic respiratory. But I guess also, to target this audience, cancer survivors, cancer patients. So the thinking is that because cancer patients are immunocompromised, their immune systems are really not at its peak, they will be really susceptible to COVID if they ever get the infection. So they are really the prime targets to be protected. So if they get vaccinated, there's really no issue about their bodies not being able to manage the vaccine because, as I mentioned, it's either a dead virus, bits and pieces of the virus, or just genetic material. It's not the live virus that's going into their systems, into our systems, into my system. Okay, but the problem really is that you might not hit the peak protection that you're expecting to get. So that's a concern. But once again, kaysa naman wala, di ba? Kasi kung di ka nagpabakuna, wala talaga. So the answer to the question is, if you're on active treatment, on radiotherapy, on chemotherapy, you actually qualify. Of course, you need to consult with your clinician, but the concern is not safety. It's really how well you will respond to it. And that's still better than not being vaccinated.
Having said that, are you saying that there would be no adverse reaction?
From the observations, from the observations so far, there hasn't been a higher rate of adverse reactions among the cancer community compared to the rest of the population who have been vaccinated.
Okay. So these are patients on chemo, radiation, patients about to have surgery, immunotherapy, patients on Herceptin or Hertraz, patients with advanced breast cancer, patients on CDK4/6 inhibitors.
Okay. There's some categories that you will have to qualify, no? But actually, these therapies aren't really available in the Philippines, so parang hindi yata masyadong applicable. Yung mga naka-inhibitors, yung mga naka-CAR-T, ano pa yung isa? Stem cell transplant patients, no? So these patients, they need special precautions. But for everything else that you mentioned, no? The only thing that you really need to do is to talk to your clinician. You will probably get a clearance. No, you'll probably be told, go ahead. And the thing to manage lang actually is the timing. Because there are optimal timings for the vaccine in relation to the therapies you're receiving and in relation to the diagnostics that you might have to schedule as part of your regular treatments.
Like meaning if you just had chemo today, you shouldn't have.
Yeah, probably, diba? Kasi you know you're gonna feel off, so you don't want to have to deal with any other issues relating to vaccination. So you kind of want to feel like you're already recovering before you have your vaccine, and then maybe you want to give a little bit of time after vaccination before you go on for your next chemo, mga ganon.
Okay. Am I coming in okay? Is my audio okay? Yeah. Or did I lose my internet? All right. So, time, you mentioned timing. What about the ideal gap between the first and the second dose?
Okay, so for that, Daphne, it's really very product specific. There are vaccines that are given 21 days apart. There are vaccines that are 28-day schedules. There are vaccines that need to be given optimally 12 weeks in between. No, so the AZ schedule is 12 weeks. So it really depends on what one receives. But maybe if I can go back to the schedule with relation to actually imaging yung may precaution. Kasi you expect that when you're vaccinated, there may be some lymph node swelling or lymph node response as part of the response of your body to produce the defenses. So one thing you need to think about is if you're a breast cancer patient, is you probably want the vaccine on the other arm, not on the arm where you had the surgery. Because in general, diba, we don't want anything being done on the arm, on our mastectomy arm, because if anything happens there, it's a little bit more complicated to manage. So you usually want your procedures on the other arm, and vaccination is not an exception. So the reason why that is being recommended is because if you happen to have lymph node enlargement on the other arm, it's going to be less of an issue compared to if it happened on your mastectomy arm, kasi baka mapag-isipan na, naku, baka METS yan or progression. So kailangang i-work up, doble problema. So contralateral arm, and probably you need to talk to your doctor about timing of imaging. Like if you're scheduled for a mammogram, for example, you probably don't want to have your vaccine immediately before the mammogram. Kasi kung may makita na namang lymph node enlargement, baka mapagkamalan na it has something to do with your with your CA.
Doc, what about people who've had a double mastectomy? Which side then?
Yan, medyo mahirap yan kasi paano naman yun, di ba? So that one, I would say, if there's an alternative site, maybe that's the kind of person who would qualify for having the vaccine in the behind. Medyo nakapagkwentuhan yan, di ba? I think one of the Parañaque, was it I can't remember which politician that was.
I know.
I think it's a province. So anyway, pwede yon, any alternative intramuscular site, or pwedeng mag-image ka muna bago ka magpa-vax para wala ng problema kung talagang scheduled ka na for that
Okay. If a breast cancer patient on treatment has comorbidity, can she take the vaccine? And if so, what kind of doctor should she consult before taking the vaccine?
Nako, mas lalo, di ba? Dami niyang problema. Meron ng CA, meron pang comorbidity. But I know a lot of us are like that, no, in this community. So, I think the general dictum naman is if you are functional on a day-to-day basis, you can manage yourself, you're not currently in the hospital, you're not sick, no, you qualify for vaccination. And typically, since our oncologists naman are also internists, before they became subspecialists, they will be more than able to assess your health status. So pwedeng isa na lang ang kausap mo, no? Si oncologist na lang, para the advice that he or she gives you covers both your cancer status together with the other comorbidities.
I see. Okay, so how should one prepare for vaccination? What should one bring? Is a medical certificate enough? Do you need to bring your mammo results, your last readings?
So actually, cancer patients are among those subcategories for which medical certificates are still required. Kasi lately, there was a revision about what's being asked for, kasi it took such a long time. It really just created so many barriers for people to decide to be vaccinated. So, pero yung cancer patient talaga, special category, hinihingan pa rin ng MedCert. So all you need to bring is that one, and the people in the screening area will honor that MedCert for as long as it is at least 18 months old. No? Not older than 18 months old.
Okay. Could you give us an idea of what it's like waiting in line? What if we get hungry? Can we eat, drink?
Wala namang restrictions. Kaso yung problem kasi, di ba, is really more to do with how do you avoid getting COVID or being exposed or infected with COVID as you're waiting. Diba, we don't like naman to eat or drink in a public place kasi that means we'll have to remove our mask and shield and then we're unprotected. So yun yung issue. It's not really anything to do with the vaccine itself, but really consistently protecting yourself from COVID exposure. Now, I know there are people who have waited really long periods in line. I've heard people waiting for 7 or 6 hours. No, so that's really, really bad. But I know now, kasi we've already started the month for several months. The system has already improved. So I hope if it's possible, na wag na lang sanang magtanggal ng mask for whatever reason. I think that's the critical thing.
Okay. Well, I waited 3 hours, so I had water, but I had a straw, and I was.
Yeah. At least sandali lang, no?
Yeah, I mean, we have, just be very, very careful.
Right.
Okay. Do patients need to take a blood test to know if their white and red blood cells are okay and fit for the vaccine? The way we take blood tests before chemotherapy.
For the chemo, yeah. Well, the clinician who's going to issue you the clearance will be the one to decide. No? Typically, it's not needed. Usually, if you're well enough to be vaccinated, your blood counts are probably going to be acceptable. But let's let your clinician be the one to decide.
Okay, and after the vaccine, what are the normal reactions to be expected? What are the red flags that you need to see your doctor again, or the side effects harder on those with metastatic breast cancer?
Okay. Typically, you expect these expected local site reactions like pain, swelling, redness, a little fever. Some people will feel under the weather. Some people will feel a little body weakness, and that's about it. And the rates for that for the general population are 4 to 5 per 1,000. So it's not very frequent, actually. And then there are reports, that are more concerning, like severe allergic reactions, but that's in the rate of 1 per 100,000 doses. So again, not very common. Now, usually we observe for reactions for about a week, within a week after the vaccination. And when anything happens within that period, we say it's still temporally related to the vaccine. So the timing is suggestive that it can be related to the vaccine, but we cannot say for certain that that's the only cause, no? And so whatever it is that happens within that time frame, you may opt to either contact the number in the vaccination card because that's the vaccine adverse events hotline, or you can go to your clinician and just update and ask for advice. Now, maybe, Daph, if I can also include at this point the concept of causality and coincidence.
Mm-hmm.
Because people have this tendency to think that something that happens after vaccination is definitely the fault of the vaccine. But we know that can't be true. No? It can be coincidental. And it's very difficult to distinguish between those two. And really large-scale observations are needed para masabi natin na, ay nako, dahil sa bakuna yan. So again, I use this really ridiculous example to drive home the point, if you'll allow me. So maybe, Cara, we'll have paraffol and we will have vaccines given to the first 5 people who signed in today. Diba? Okay ba yon, Cara? Pwede ba?
Powerful naman ni Cara. Kaya,
Oo, kayang-kaya niya yan.
Pressure.
Mamili ka pa kung anong brand mo, diba? Kahit brand agnostic tayo. So anyway, nagparaffle si Cara, napili na natin yung 5 pangalan, may nakarating pa tayo ng Cebu, pinayagan tayo. So we go, we vaccinate, and we observe. And in the space of that 15-minute observation period, suddenly we noticed that one of our ICS sisters' hair suddenly becomes curly from stick straight. Okay? So we say, oh, how cute. What are you using? Pwede palang ganyan, di ba? And we leave it at that. Now, the next person we go to has the same reaction. The next person we go to has the same reaction. Same with number 4, same with number 5. So what do we conclude? But this vaccine is so cool. Not only does it bring COVID protection, it also makes your hair kulot. Diba? Okay. Double purpose. But at that point, you say, okay, talagang galing yan sa vaccine because everybody we vaccinated or the majority of people we vaccinated had the same reaction. But in many cases, pa isa-isa lang eh. May isa, dalawa. So you don't know. Baka naman she used some, I don't know, some shampoo or something. Kaya ganon, no? So it's very difficult to separate. And only when you have these large-scale observations and databases will you be able to say, na, ay nako, it's because of the vaccine and we need to figure out how to do this better. Or find people who like to have pulot hair to be the ones to receive this vaccine lang.
Right. Anyway, during the vaccine day, they give you a list of possible reactions to look out for. And I heard somewhere like they're not side effects, they're expected effects. You know what I mean? Like body pains and for me, I felt hungover for 2 days.
Oh, wow.
Okay. I just, okay lang.
Yeah, but that's the thing then also, Daphne, di ba? Parang if you have something scheduled the following day,
Yeah,
or
don't
you have,
do it naman.
parang
I
you
did
kind of
that.
anticipate.
Exactly. So I did that for my second dose. I knew because I had taping already. I said, oh, I'm off this week because I expect to be a little tired.
Yeah.
So, yeah. Okay. So let's move on. What are the disadvantages of not taking the vaccine for those patients on treatment? What are the risks and disadvantages?
Oh, well, unfortunately, because particularly for people who are still undergoing their therapies, they do expect to be immunocompromised. Their immune systems are not going to be at its peak. And there's, of course, this higher risk of being exposed and infected with COVID. And unfortunately, also for this patient population, there's also a higher risk of worse outcomes, getting the more severe forms of the disease or even dying from the disease. So that's really why even as we understand that there are risks, we might not be able to get the full protection. We might not have as large a database on which to base our recommendations. The risk of COVID itself is significantly large, that the benefit of vaccination outweighs those risks.
Okay. So can the vaccine cause other diseases or increase our risk for major disease?
Okay, so that will fall under the heading of long-term side effects. And at this point, we really don't know. But what we do have in terms of information is really based on the experience with the platforms or the technologies that are being used for this vaccine. And the ones that are available now are, there are older technologies, there are newer technologies, but they're all technologies that have been used for other vaccines. And the observation has been that the vaccines for which those technologies have been used have continued to be safe and efficacious.
Okay. I see something here. After my second dose of COVID vaccine, am I allowed to take my flu vaccine? Because that's me. I want to do that too.
Yeah, of course. We just typically leave a 2-week interval between the doses of these vaccines, just so that you don't get confused and attribute whatever it is you might feel after the vaccination to one or the other.
Is it important to still get vaccinated for flu? I mean, we're not really going out.
Well, yes, that is true, But the thing is, particularly for these respiratory infections, what WHO has said is this: if you expect that it is a possibility for you to get really bad flu or really bad pneumonia, and you will have to compete for resources for the same stuff that somebody with COVID will get, parang who do you think will be prioritized, di ba? So parang ayaw na natin makipag-agawan pa dun sa sistema na pare-pareho tayong gagamit ng oxygen, ng ventilator, ng hospitalization. So yung pwede mo nang maiwasan by receiving, for example, your flu vaccine or maybe pneumococcal, if you're qualified for it already, you should be vaccinated for those.
So those other vaccines, flu and pneumococcal, are you have to pay for them, available privately, right? Your doctor.
Yes. Well, yes. But I know that there are LGUs which are providing flu and pneumococcal vaccines for the elderly population as part of their regular vaccination program. So that can be free of charge.
That's amazing. Okay, so regarding the COVID vaccine, in case there are people here who still don't know how to do it, how do we avail of the vaccine?
Okay. So the DOHFB page has this parang roadmap. I'll try to see if I can call it up. No? And basically, the steps are you need to register, and then you fill in information that they need so that they can establish that you belong to a particular group, like maybe A2 senior or A3 with comorbidity, which includes cancer. And then they need information to verify your identity. And then basically you just wait for a call so that when it's your turn, the LGU will call you. So those are pretty much the typical steps across the different LGUs. They might just have different portals that you have to enter.
That's right. Okay. Breast cancer survivors on remission, are they considered patients with comorbidity? I think we mentioned that. So they will be prioritized. They're part of the A3, right?
Yes, yes.
Breast cancer.
Still part of A3.
Okay. Now I have some questions here that were given earlier from the audience. I'll just get to it. Does Sinovac cause breast pain?
Parang ngayon ko lang narinig. Pero it shouldn't unless it's referred. Perhaps if you had it in the contralateral arm and there's swelling here, then there could be a little bit of referred pain. The pain at injection site can be quite variable. No, I mentioned earlier, I hardly felt anything. There are some people who felt a little arm heaviness. There are some people who felt heaviness up to the shoulder. So for some, maybe pwedeng mag-extend sa breast. Pero dapat, kung vaccine-related, it shouldn't last very long. So kung medyo matagal yung symptoms, like beyond a week, dapat siguro kumonsulta na.
Yeah. Okay. Can I mix vaccines? First dose is one brand, second dose is another brand.
So for now, that's not recommended, no, because the studies that we have to support safety and efficacy of these vaccines are all based on receiving dose 1 and dose 2 coming from the same brand and following the recommended interval. But there are also studies now starting off looking at mixing brands because we expect that there will be some issues sometimes regarding supply or tolerance of the vaccine. And so once this data is available, the recommendations might be revised.
Okay, this is an interesting question from our audience here, and it's something that we all deal with, especially in media and me and UNICEF that I always have to deal with. Vaccine hesitancy is also caused by fake news. One of our sisters shared a video where this guy claims that whoever will get the vaccine will die in 2 years. How can we stop all this fake news?
So you know that particular video was actually being shared sometime before for another issue. Na-resurrect siya. So you can just see, no, that a lot of these are stories that are taken out of context and are not referring specifically to, let's just isolate it to COVID na lang, diba? So this has been going around for quite some time. So kung sinasabi natin, ay itong mamang to was talking about COVID vaccine, obviously hindi, no? And pangalawa, hindi naman yun yung pinag-uusapan niya. So going to your question, how do we vet this news? Oo, how do we stop it? So I guess we have to be very careful about how we consume this information and how we share it, no? There are a lot of what you would call fact-checking sites online. And I would encourage people that if you find something that is very distressing or makes you feel afraid, I think that's really one of the key things about these posts, no? Nananakot siya. Fact check first. Just type in the keywords fact check and you'll probably get something that's explaining that particular post before you even share it.
Well, the gold standard, of course, is the World Health Organization. the DOH for our country, and UNICEF is also a partner. So I always say, when before you consume this unverified news, just go to the verified sources, which are the WHO, DOH, and UNICEF. And in fact, I think social media sites like YouTube and Facebook are already partners in helping stop the spread of these fake news. However, dumadami siya masyado sa Viber kasi hindi naman pwedeng i-stop yung spread ng fake news, i-report ang sa Viber. So I would like to ask everyone to not forward things that are unverified, kasi it is so dangerous, I think, even for the efforts that our government and our partners are trying to do in achieving the goals of mass vaccination. So we really have to play a part, be a part of the solution rather than a problem, right?
Right, I agree.
My 2 cents there. Another question from our audience is, what is the rationale behind the policy that cancer patients with controlled malignancy could get Sinovac only? Are they getting brand specific in the rollout?
That's giving me a little pause, Daph. Kasi as far as I know, from our discussions in the NITAG, there wasn't any recommendation specific to cancer survivors. So maybe that's a misunderstanding. I would encourage the sister who asked that question to check again with the LGU. Baka
So
hindi lang naintindihan. Parang walang ganung klaseng recommendation.
Oh, okay.
Or pwede namang pwede namang if there's an issue, if that's actually preventing her from being vaccinated, pwedeng lumapit diretso dun sa City Health Office kasi they're patched directly through DOH and they will have more specific information.
Okay, good to know. Is there an effect if I'm taking tamoxifen? Is there a specific vaccine allowed for people taking tamoxifen?
No need to specify vaccine brands, even if the patient is on tamoxifen.
Okay. From Leanne Navarro, I was advised by my oncologist to have my PET scan at least 2 to 3 weeks after vaccination. I hope that helps. Yeah.
Hi, Kiani.
Okay, from Helen Novio Paglikawan. First dose ko na AstraZeneca vaccine done na. Pero my second dose will be July 22 pa. May bone therapy ako last week of June. Okay ba na magpa-bone therapy ako?
So mauuna yung kanyang bone therapy before the vaccine, tama ba?
Yes.
And there's an interval of about 3 weeks, is that it? Okay, that should be fine. Kasi the reason why I'm verifying is because basically we just want to make sure that by the time you get to your vaccination, you pretty much recovered from whatever it is that they're going to give you. So kung up and about ka na, you're feeling normal, then you can proceed with your scheduled vaccination.
Okay. From Doris Noval. Hi, Doris. What is herd immunity? What happens if the Philippines is not able to achieve herd immunity?
Okay. So that's a really interesting question because that's been the target ever since the vaccines were rolled out. We kept hearing about herd immunity. And basically this is saying that even if we don't vaccinate 100% of the country, if you vaccinate a large enough segment, you can control the spread of the disease. So based on calculations, this is pegged at about 70% of the total population of the country. So if we're at about 100 million, we're talking about 70 million people. Okay, so just for contrast, every year, we have about a 3 million target cohort for children, for childhood vaccination, and we don't hit that target at all. Parang we've hit about 60 to 70% lang. So this is now 20 times more different population. Now we're talking about adults and elderly na medyo mas pasaway kaysa sa bata. So mahirap, talagang very challenging. Then also in the context that we don't have a lot of vaccines. So even as we want to target herd immunity, kasi sabi natin pagka nakarating tayo doon, titigil na yung pagkalat ng sakit, hindi naman bawal to target yung pinaka-vulnerable, which is A2 and A3. So seniors, those with comorbidities, kasi pag nasuyod natin yon, then we don't expect, or we can be confident that our healthcare system can manage. And doon naman tayo namomroblema parati, di ba? The 2 times that we locked down, what happened? It was really because our health system couldn't manage anymore. We're over capacity. So we don't want that anymore. So why do we get over capacity? Because those who are vulnerable aren't protected. If we protect them, then we won't hit that anymore. So if you are A2, A3, anybody in those categories, please be vaccinated na.
So do you think realistically we'll not hit 70%?
It'll take a long time. I don't think, kasi supply issue pa lang pinag-uusapan natin, mahirap na di ba?
Right.
So, maraming logistical considerations.
Okay. Wow. Okay. Well, also, as we see, I see a lot of people comparing our situation to more advanced countries, and I think that's like a recipe for, anxiety.
Vaccine envy.
Exactly. Like, why? But anyway.
Oy, wag naman. May partida naman sila. Last year pa sila nagsimula. Tayo March pa lang eh.
At saka, priority sila. Well, hindi sila nagbigay ng, anyway.
May
Nauna
pera sila.
sa supply, di ba? Nauna sa supply. But anyway, at the same time, we're seeing these advanced countries letting go of masks already. However, according to the WHO, it's too soon to let go of the mask. What is our stand on that?
It's too soon to let go of the mask. I agree. Lalo sa atin, no? I refer to the A2 and the A3. The A2, we've covered 5%. A3, that's the ones with comorbidities, we've covered 2%. So, ang layo pa. Liit pa. Kaya ang dami pa natin pwedeng gawin. So, I'm challenging this community. Yeah. Diba? I'm sure meron tayong mga kilalang senior, no? Hindi forgivable na hindi pa sila napapakunahan kasi very qualified na sila. Yung mga may comorbids, baka challenging, pero pwede.
Actually, I also found that it's very effective when somebody has been vaccinated and feels strongly about it. Your advocacy, your message, even just to a friend, it makes a difference. So feel free to reach out and be an advocate because it really helps. And I think our community really needs this kind of support and encouragement. Yeah, especially there's like somebody said here, the vaccine hesitancy. We have more questions. You still have time, Doc? You're okay pa, no?
Yep.
Okay. From Pauline Espiritu, can a person who has had a full dose of COVID vaccine be administered another full dose of a different brand, observing the number of weeks apart? You mean fully vaccinated na, double dose of one brand, and then have another brand? Alam ko to, siguro you have travel, whatever. Yeah.
That's actually a frequent question, Daph. Kasi particularly yung mga nakakabalita na if they want to travel particularly to the US, there are specific brands that are preferred. Right now, kasi wala pang ganun recommendation. Oo. Wala pa eh. Kasi we don't have enough data. So right now, let's just stick to dose 1 and dose 2, same dose, using the recommended interval. That kind of data will come. It's inevitable eh, kasi may mga circumstances talaga na kailangan natin ulit mag-redose or kung magkaroon ng findings na kailangan ng booster. Pero sa ngayon, wala pa. Kaya hindi natin ma-recommend.
When do you think that the health experts will figure out if we do need a booster or another round?
Well, 2 nights ago, I was scanning through some of the new literature, and there was this really interesting study that came up talking about doing bone marrow aspirates on healthcare worker volunteers and trying to find out whether they had memory cells following COVID vaccination. Okay, so because those cells indicate long-term immunity. And guess what? They did find those cells. So that's very encouraging. It's very preliminary. It's a very small study, but seeing things like that kind of gives you hope that this immunity might be long-term. But again, it's very early days. So it's just to show you how dynamic the situation is and how much new information comes in on a day-to-day basis.
Yeah, they say science developing, right?
Right.
Right. Now, how do you check antibody levels, Doc, para ma-determine yung efficacy ng vaccine?
Okay, so interesting question. Unang-una, hindi kailangan i-check kasi ang problema ganito, gusto man natin makita na may antibodies tayo, wala pa nung tinatawag na correlate of protection, meaning that the level of antibody that will indicate that we are actually protected is not yet established. Tapos, hindi pa rin natin alam kung yung tinetest na antibody ng iba't ibang tests na available ngayon ay yun talagang test na kailangan natin. That's why hindi standard ngayon na sinasabing after you vaccinate, please do a test. Walang ganun.
Okay.
Maybe in the future magkakaroon tayo, but now there's no standard recommendation.
Okay, good. From Tins. Hi, I'm watching from UAE. Hi, Tins.
Hello.
I'm a breast cancer survivor and under hormonal treatment. Until now, the doc doing vaccination won't allow me to undergo vaccination. He said it's not allowed because I'm under medication. Please clarify.
Uwi ka na lang dito, Tin. Paunahan ka namin. Pwede naman dapat.
Pwede naman. Baka iba-iba lang yung mga ano, no?
Well, yeah. Or maybe, specifically, I don't know whether may access ka siguro sa oncology specialist dyan. Baka pwede kang humingi ng certification that you're allowed. Baka pwedeng ganun.
Sige. From Mars Pascual, I have a scheduled PET CT scan on June 8th. Still waiting for a schedule of vaccination. Is there a recommended time interval again between these two procedures?
So siguro explain natin sa kanya, no? Yung problem kasi is, pwede ka talagang magkaroon ng enlargement of the lymph nodes after vaccination. So dahil tayo ay breast or rather cancer survivors, yun ang hinahanap di ba, lymph nodes. So kung may nakita sila, parang ang hirap nilang sabihin, ano yun, galing yun sa bakuna or galing sa sakit. So kaya tayo nagbibigay ng interval. So preferably, mauna na sana yung image mo bago ka pa magpa-vaccinate para wala nang problema, di ba? Pero kung naunahan ka magbakuna, typically ang sinasabi nila mga 2 to 3 weeks after, saka ka magpa-image para kung ano man merong makita, it's less likely to be associated with the vaccination.
Doc, paano yung I mean, not just for the breast cancer community, but for the general public. Kasi ako, when I go to my farm, dyan lang, sa tabi-tabi, ayaw talaga nila magpa-vaccine. Sabi nila, hindi naman ako tinatalaban ng wala naman What do we say? How do we convince people that the vaccines are good for us?
Paano nga ba? Hirap sagutin, Kasi, well, ganito. I think we have to recognize that people's reasons for not being vaccinated will vary. No? There are some people who just need a little bit more extra information. When you explain things to them, they're very willing to be vaccinated. There are some who are not being vaccinated because of a prior experience. They're really afraid, and you just have to figure it out, and try to come up with a reasonable explanation. Siguro in this specific instance, hindi ako tinatalaban or hindi naman ako nahahawa. I would say two things, Maaring hindi maka-apekto sa'yo, pero dun sa mga kapamilya mo, lalo na yung mga may edad na kasama mo sa bahay, they're very vulnerable. Tapos kung ikaw ang nag-uwi ng sakit sa inyo, kaya mo bang tanggapin na ikaw ang nagdala ng problema sa iyong pamilya? Pangalawa, let's think also about our contribution to keeping this disease from spreading in our communities. Pagka bakunado na tayo, bawas na tayo dun sa nagdadagdag pa ng pagkalat ng sakit. Pangatlo, I always like to tell people if they've never had the experience of having a family member go through COVID, I would not wish it on you. It's a very isolating illness. Alam nyo, bukod tangi itong sakit na to, lahat tayo pag may kapamilya na nagkakasakit, pwede nating dalawin sa ospital, pwede tayong magbantay. Pwede nating damayan yung may sakit. Eto walang ganun bawal yan kasi mahahawaan tayo. So marami tayong nababalitaan na na-ospital na, ICU na, namatay na, ni walang nakapunta para magbantay. Nakalungkot. Doon talaga ako nalulungkot sa totoo lang. And I don't think this is something, it's very alien to the Filipino culture. Yung may sakit na hindi mo madamayan. Feeling ko yun yung pinakamahirap dalhin.
Oo nga. Wow. Sige, Doc. Thank you. Sandali lang. Don't leave us yet. You still have, are you, we still have a few minutes. Maybe.
Yeah.
But in the meantime, I would like to call on Nicoy de Guzman, President of I Can Serve, and she's going to talk about getting jabbed on the thigh. Hi, Nicoy.
Hi mga sis. Hello everyone. So yeah, I got my first dose last Thursday, bali 2 weeks ago, and I got it on the thigh simply because I've had a double mastectomy already. Bale, the first one was way back on my left side. That was still around 2002, and then I had another one on siyempre sa right ng 2015. So that's 5 years ago. So nung left pa lang, I used to have all my shots and everything on the right already. I was already taking care of the affected arm, kumbaga. And then now that yung right na mastectomy din, so binabalik ko sa left. So I've been getting naman like, mga swero, ganyan. Nilalagay ko naman sa left and okay. But then personally, I didn't know how I would react to this vaccine. So I was thinking, I think I'd like to be safe. I'd rather not have it on the arm and have it somewhere else. Ngayon, you might say, oh, bakit sa thigh? Bakit hindi naman sa butt? I was just thinking also, I think it's because naman our vaccination areas. Doc, siguro for consideration yan. Parang hindi ho naman maganda na quote-unquote, didiretsuhin ko na ho, magtutuwad tayo doon, di ba? So I had it na lang po on the left arm, yung mas matagal na nagkaroon ng mastectomy. So doon ko na lang nilagay. And true enough, I had AstraZeneca. I didn't have the other like fever and everything, just the general heaviness. But it was my arm really hurt. I mean, my thigh really hurt. Medyo hindi ako nakalakad ng maayos for like 2 days. So yun. Pero I was happy that I already had the vaccine and that I had it on the thigh. Kumbaga, una sa lahat, better than wala. And I think it's because it's a large muscle, medyo mas kinaya. So yun po ang naging experience ko. So for double mastectomy, parang mas better po nga kung sa thigh na lang tayo. That's what I want to share.
Wow, Nicoy. Did the healthcare worker ask you
Bakit doon?
Yeah, it's on that info sheet naman that I had a double mastectomy. But prior to that, I was really telling them talaga sa thigh na lang. Yun. And it was quite new for the healthcare worker because she called a doctor. Parang she was
refer pa siya.
Parang, ma'am, hindi ako dito. She was, kumbaga, straight enough to say that. Sabi, ayan. So, talagang denied rin siya kung saan rin sa tayo.
Right. So, Nicoy, siguro if I can add, actually, tama ka naman, no? Ang vaccine kasi, for as long as you are able to inject it intramuscularly, it doesn't really matter which muscle, basta merong muscle na accessible. Yung thigh kasi yung ginagamit natin sa pediatrics, di ba? For children who are not yet walking. Kasi nga, non-weight bearing siya. So, kahit mamaga doon, parang hindi natin ini-expect na mahihirapan yung pasyente. Pero syempre tayo, adults, naglalakad tayo. Kaya medyo masakit. Kaya hindi talaga siya preferred site. You want here kasi it's not weight bearing. But again, with the restrictions that you have, then it's a reasonable option.
Okay, that's interesting. Good to know. So for everyone else who has similar concerns, consider that and just let your healthcare worker know when it's your turn. Anything else you want to say, Nicoy? Thank you for sharing that. It's very, very useful. Okay. So we'll take up more questions from the audience. We have Lit Beltran. I had AstraZeneca jab last week. Can I still get Prolia injection? Yeah.
So basically talking about not missing out on your regular scheduled medications, treatments, even if you've been vaccinated. And that's pretty much why you want to talk to your clinician first, so that if there are some changes in your scheduling, then this can be coordinated well.
Okay. A question also. I'm 38 and single. I'm a post-status breast mastectomy cancer survivor for 9 years now. I've been attending my regular checkup every 6 months until the pandemic happened. I've been staying home since day one of lockdown because I am immunocompromised. I would like to ask, is it safe for me to get COVID vaccine with or without medical certificate from oncologist? Takot akong lumabas to meet my onco dahil sa COVID sa ospital. I hope I can get answer to lessen my worries.
Okay. I think, without going into very involved explanation, siguro kung med-cert lang naman yung kailangan mo, pwedeng teleconsult na lang. You can just consult online para hindi ka nalalabas for that particular document, no? And kung sasabihin naman ni doctor na I think I need to see you just to make sure that you're okay, then right now kasi, especially for cancer survivors, a lot of institutions will implement an appointment-based system so that you don't have to be in the hospital for a long time before you're seen. No, so that's an added precaution. And then once you have your documents ready and you're going to the vaccination center for the procedure, you can also ask, or hopefully your LGU has an appointment-based system para you're not waiting too long. But I know some people, what they've done is ask somebody else to fall in line for them, and then when it's your time, then you go. No, pwede namang ganon. Pumapayag naman sila kasi lalo na kung merong mga health issues, they're quite accommodating for that.
Okay. Doc, this is from Sel Ahon. Are there standby emergency response teams of vaccination sites? Kunyari pag may allergic reaction to the vaccine?
May SOPs, no? So ang vaccination sites are instructed to respond to particular scenarios, and if they're not able to respond there, then they also have a system to transport to the nearest centers.
Okay, something just came in here in the chat box. I just saw, please have the doctor react to the Facebook comment, Cleng Ricafort. Vaccines will not stop COVID from infecting us.
Correct, that is true. So the vaccines, the data that we have from the vaccines right now strongly support that they will prevent moderate, severe, critical disease and death coming from COVID. But we still do not have enough information as to whether these vaccines are transmission blocking or can prevent infection. So having said that, I'm fine. So personally, I'm fine to be infected just so long as you tell me I'm not going to get sick, go to the ICU, or die from it. Because without the vaccine, those are all possible scenarios, right? So what we're trying to do now really is to make this disease more manageable. We're hoping for the bonus. We're hoping that it does prevent transmission so we can really control it, but we're not yet sure. And the data still just coming in, showing actually that for some of the vaccines, at least, there is enough data to say it's transmission blocking already.
Okay, so, but the bottom line is it will help prevent severe disease.
Oh, yes, definitely.
And,
that's what the data is telling us.
Okay. And this is why we still need to wear masks.
Yes, correct, exactly. Yep. Thanks for emphasizing that.
Yeah, because, like, very important.
Yeah.
Okay, I'm already fully vaccinated Sinovac through LGU. Our company ordered Astra for employees, but will be delivered July pa. Can I be vaccinated again as a booster? I think we already mentioned that.
Yeah, oo. Wait na lang tayo. Sana by July, meron ng bagong information kung pwede. Pero sa ngayon, wala pa.
Pero parang effective pa naman yung 2 dose natin, di ba?
Well, yeah, maganda naman ang data. Actually, there's more information coming in regarding Sinovac in particular. Real-world data showing that it's quite, the results are very favorable.
Okay. Well, Doc, is there anything else that you wanted to add? Because I know that you have a meeting with IATF or DOH.
Yeah.
Any parting words for the ICS sisters?
I hope that this webinar has been helpful to address some of your concerns about being vaccinated. I really wanted to touch base with this community because I know a lot of our sisters are quite concerned about whether they qualify for vaccination, whether they're suited for the vaccines, no. And I have to say that because we are at risk, then we should be the targets, no. We should be receiving the best protection possible from the available vaccines. So the data is quite reassuring. Even for people who are currently undergoing treatments, safety is not the consideration. It's really the efficacy because we expect some kind of decrease in the reactions or in the protection. But again, if you compare that to not being vaccinated, which is zero, ano ba naman ang pipiliin natin, di ba? So I encourage everybody to please consult, no, with your clinicians, get your clearances, be vaccinated as quickly as possible so that we not only protect ourselves, our family members, we also contribute, not to controlling this disease in our community. And I'm sure we all want this pandemic to end as soon as it can possibly be done.
Doc, sorry, may isang pahabol lang talaga.
Sure.
What's your take on ivermectin? I know people not wanting to get vaccinated because they took ivermectin.
Well, so unfortunately, no, currently there's still no solid data to support ivermectin's role for prevention of COVID-19. So I would say that until that's available, then we should actually be benefiting from the interventions that have solid evidence, which is vaccination and also practicing our minimum public health standards.
Thank you. And before you go, maybe since we, the sisters have not been together for a long time, is it okay? Is it baduy if I ask for a group photo? Please turn on your cameras. We want to see your beautiful faces. Who's gonna take it? Kayo, okay, si Cara. So smile naman dyan. Hi, beautiful.
Okay, 1, 2, 3, smile. Okay, hang on, next page. 1, 2, 3, smile. Kevin, turn on your camera, Melody. Okay, thanks.
Thank you. Okay, so on that note, Doctora, thank you so much, Doctora Anna, for everything that you do and for your very precious time for spending it with us here. We appreciate all your messages and the facts that you shared. Thank you again.
Thank you, Daphne, and thank you to the I Can Serve team.
Okay, be well, Doc.
Take care.
Thanks. Bye-bye. I still have someone that I would like to call on who would like to share. Very quickly, we have Marivic Bugasto, president of Minda Buddies of Baguio. She's a volunteer for I Can Serve, and she has advanced breast cancer. She got her first dose fairly recent. So maybe Marivic, you would like to share?
Yeah, hi, good afternoon, everyone. Yeah, I had my first shot, AstraZeneca, May 14. Bilateral mastectomy also. Luckily, si Nicole nasunod, no, na either the thigh or sa buttocks. My sister and I both bilateral mastectomy kami, no? Hindi sila pumayag. So lalo na, it was kind of difficult for my sister because she has lymphedema, no? Assessment na lang, they jabbed her on the arm that was less swollen. Ako naman, pinipilit ko na sana either because like Nicole, I was scared ng kung anong magiging effect. Baka naman tumubo bigla yung boobs ko, di ba? Anyway, hindi sila pumayag. Tumaas ang blood pressure ko. Kaya I had to wait another 30 minutes. Kasi yung talaga, I was insisting on what I knew and what I understood from all the webinars that we have been attending about the vaccination. Anyway, good pa rin that I had the shot. although I had to take it in Baguio, kasi where I am in Tuba Benguet, very slow ang rollout. So, desperate na ako because I have asthma, I have hypertension, and then I have diabetes, tapos I'm a cancer survivor pa. Di ba parang bingo? Ganun. So, alangan naman hindi ako mamatay dun sa lahat ng sakit na yan, mamatay ako sa COVID. I was really desperate. You know why? Our next door neighbors, the whole family was, they all tested positive, and the padre de familia passed away. So, alam niyo yon, yung takot, sobra-sobra. So, good thing I had vaccination. There was something about Prolia kanina. I had my Prolia shot. Thank you, I can serve. I had my Prolia shot last Monday. Inischedule na lang ng aking onco. When I went for the vaccination, I had a clearance from my onco, from my pulmonologist, and from my primary. Yung talagang salpak ko sa mukha nyo kung hindi nyo pa ako in-injection. Yung ganun ba? Yung talagang insistent ako. Here in our place though, kasi very simple folk, farmers, ganyan-ganyan, I was asked to talk to the people sa barangay kasi maraming no takers. Gaya nga na sabi ni Doktora, di ba? How sad naman that the seniors and then those with comorbidities, hindi sila nag-ano, they don't avail of the vaccination just because of yung gaya na sabi ni Mayan, yung maraming fake news. When I was asked yun sa aming sa Ilocano, why should we have the vaccine? And then I said, it's all because of love. Kung mahal mo ang sarili mo, no, I attempt to bagim, you will have the shot. Kasi ayaw mo magkakasakit, ayaw mo na nobody visits you, and then takes care of you, ganyan-ganyan. You love yourself, have the vaccine. You love your family. Kasi if you are in the hospital, they cannot visit you, you cannot imagine the anxiety and the worry. You love your family kasi imagine naman, we have a friend who was who had severe COVID and then hospitalized dyan sa Manila. Tigarito siya sa amin. She had to, parang kinolateral daw niya ang title ng bahay nila because her bill went up to about 3 million.
Wow.
If you love your family, you will not allow them to spend that much. And then recently sa church, sa aming faith community, an old lady, nag 300,000 siya. And then she's at home now. They brought her home kasi wala na. Yung parang they're waiting na lang. You know, yung sabi ko, if you love yourself, your family, and your neighbors, magpa-vaccinate ka para hindi ka magka-COVID ka man, hindi ka mamamatay. Yun yung mga explanation ko sa kanila. Anyway, from the boondocks of Benguet, it's very foggy. If I can just show you in the back, there it's very foggy already and starting to rain. Love to you all. If only I could, if someone wants to meet the sacks of lettuce in Cubao, you just PM me and I will send a sack or 2 sacks like I always do for everyone in I Can Serve and all our other sisters. O padala ko sa Cebu, Mayan.
Thank you so much, Mary Vic. You're so sweet, and I really like your message about just the practical side of getting vaccines. Mahal kasi talaga. Aside from it being so scary to have COVID, ang mahal magpa-hospital, di ba? So thank you so much, Mary Vic.
Thank you too.
Be well. Thank you. Okay. Well, super bitin ang kwentuhan natin. Pwede niyong balikan ang recording na ito sa I Can Serve Facebook page. Mananatili siya sa Facebook ng I Can Serve. Thank you again to Dr. Annalisa Ong Lim. Ang dami natin natutunan, right? And sana natanggal ang takot ninyo at mga pangamba tungkol sa bakuna. Pag nagkaisa tayo, hindi makakalusot ang COVID sa atin, kaya magpapabakuna tayo. Okay? And on that note, I would like to call again on the President of I Can Serve, Nicoy de Guzman, for our closing remarks.
All right. So once again, good day, everyone. Nicoy de Guzman here, your president. And once again, I would like to thank everyone for attending today's webinar, Bakuna at Breast Cancer. Maraming salamat ulit kahit na nauna na siyang mag-leave ng meeting kasi nga busy sa ating resource speaker, Dr. Annalisa Ong Lim, for being available. Alam natin na after her first webinar, like I think that was a month ago, naging na siyang sobrang busy kasi kumbaga viral levels na siya eh. So yon, maraming salamat po to our sister and resource speaker for today, again, Dr. Annalisa Ong Lim, for being with us. Thank you also to our host, Daphne Osenia Paez. Thank you very much, sis, for being with us and facilitating this webinar. She's a staunch advocate of vaccination, and thank you for being there. Last but not the least, salamat po sa ating audience for attending and for spending your Saturday afternoon with us. Thank you po sa inyong mga questions na pinadala. As you have seen, wala po kaming presentation. Wala po tayong presentation. We just really wanted to zero in on your questions. So maraming salamat po. And sana po, like what Daphne said, nasagot ang inyong mga tanong at nabawasan ang mga nervyos or agam-agam tungkol sa pagbabakuna, lalo na ngayong may pandemic. I Can Serve hopes to come up with more relevant webinars in the future. So please do let us know if there are topics you'd like for us to discuss or for us to touch. Till our next webinar, keep safe everyone. God bless po. Thank you.